We would love to hear from you. The population of England and Wales saw the biggest annual increase in 75 years. So it's now, well, there's never been this many people in the country, 61 million people in England and Wales, according to new estimates. The rise in the year leading up to mid-2023 is mostly due to immigration. 622,000 more people arrived legally from outside the UK than left. By comparison, there were only 400 extra people in England and Wales as a result of births outnumbering deaths. Amazing, the birth and death rate is pretty much neck and neck. So it's the lowest so-called natural change to the population since mid-1978. Labour have said they're going to reduce net migration, but unlike the Tories, did not commit to a legally binding limit in their manifesto. It's also been reported today Labour are delaying legal restrictions on foreign workers until next year. Owen, what do we think about this? Do we need this many people?
Yes. I mean, if you start going through the list of who people arriving are and go, well, who do you want less of, then people start to struggle. Because it's interesting when you ask the polling, do you think we should have less immigration? People say yes. And then you start asking people the specific breakdown and people say no. So, for example, the biggest portion of people arriving are foreign students. Foreign students pay £28 billion a year to this country. So the question is, if you want fewer foreign students, which services do you want to start cutting even more on top of the cuts we already have?
You don't want them to bring their parents along, do you? I mean, that's obvious.
Well, I mean...
Why would you bring your parents to university?
Well, I mean, the vast majority don't. But they don't. They just don't. And in any case, they're a net contributor of 28 billion. The other point is,
go on.
Migrants. They're also we bring in foreign doctors, nurses, skilled workers, but also they tend to be younger people. They are less likely to use healthcare. They're more likely to work, pay tax. They contribute to society, and our birth rates collapse. We have an ageing population. If we don't bring more people in, then you're going to have to start cutting public services.
The significant thing is that the birth rate and the death rate are the same.
Yes. So we're not replacing the population, I think is the point. It's going to shock you, Jeremy. I actually agree with Owen on this policy. I actually think that immigration, effectively allowing for an arbitrary target, saying that we're going to limit immigration just like that with this particular number, is wrong. However...
So you want to just let people come if they want to come?
So, I think that immigration is good for the economy. I think that it's wrong for governments to tell businesses who they can and cannot employ, whether that be somebody in this country or foreign worker. However, at the moment, we currently have huge amounts of public services that are currently being spent on. We spend huge amounts of money overall, and actually we've got the highest tax burdens since the Second World War. And all of those people can come to this country, and when they come to this country, they're able to take off of those public services. So I think we need to have conversations about where the money comes from, how we're actually going to improve public services in order for us to be able to cater for those people. Because at the moment we can't. We've got net migration of 622,000. People
but you sound like you're in favour of it, but you're not in favour of it.
No, so I'm in favour of it in principle.
You just want young, fit people to come.
We must first restrict the size of the state. We must first roll back the size of the state before we can allow.
I'm confused about your. I'm confused. The reason I'm confused is, if people want to reduce immigration, then they're going to have to accept that means less money going into the public coffers, because as we know,
less taxpayers. Yeah.
Well, you get less taxpayers, and they tend to be younger. They're less likely to be. Look, people who depend on the healthcare system most tend to be older, retired people, and we want them. They've worked, they've lived their lives, they need to be supported. People who arrive here are not pensioners. They're people who tend to be younger, and they don't use those public services to the same degree.
We spend 4 times the size of the entire budget of the Ministry of Defence on pensions alone.
Rightly so.
I think no, I don't think so. A quarter of them are millionaires.
We've got 2 million pensioners living in poverty.
A quarter of them are millionaires.
Quarter of them are millionaires. We shouldn't be giving taxpayer money to millionaires.
No, you just tax them more on their income and wealth, and then you recoup it. It's very easy.
We already tax an incredible amount of money overall. Anyway, on immigration specifically.
Yes. Explain, because I don't.
You're a bit confused about my opinion.
I'm completely confused, because you want lots of people to come in so long as they're fit.
No. I want people to be allowed to come to this country and work in this country, but not receive public services, not as strange public services, and not gain on the benefits.
What happens if somebody breaks their leg while they're working in a care home?
This is the point. I think that the national health. I think we need a fundamental reform of all public services. I think the NHS needs to be completely reworked. We need institutional reform to improve its services, but also
apple
to allow
pie,
people
isn't it? I mean, we all sort of want.
But also, look. My partner's a Brazilian doctor, and he's just transferring his medical qualification here so he can work in the National Health Service. As things stand, if he wants to use healthcare, then he pays for it. What I would say is, you don't need a situation where people come here and they avoid using healthcare because of the cost, and then you start having illnesses.
I think
so your partner is going to be a doctor in this country?
Yeah, he's an A&E doctor in Brazil,
great.
but you can't just walk into another country and go, I'm a doctor, stop working for the NHS.
No.
You have to then transfer your qualification.
Genuinely, if Owen's partner broke his leg, you'd say he'd have to pay for that?
Well, no, I think that everybody... I think that I want the entire
You want everyone to
system
pay for it?
No, I think the entire system needs to be reworked. As I said, I want a social insurance model of healthcare. I think the NHS is broken. I think it's a bureaucratic black hole. And I think we continuously spend huge amounts of taxpayer money on the National Health Service that needs reform.
It was working properly before.
Let's get a call, because we all sort of agree the NHS has got a problem. Terry in Kent. Hello, Terry. How are you?
Yeah, I'm all right. How's you?
Yeah, not bad. Not bad. Just come back from holiday.
Yeah, I hear. The question is, the limit on the people coming in this country has got to rely on the housing situation and the situation in the area. You know, and no point in inviting like 200 people in this country if we haven't got the houses, like the hotels, isn't it? They're in the hotels. The reason why they're not being processed is because we haven't got the houses. So if you process them, what do you do with them? Stick them on Salisbury Plains in a tent?
I think we mustn't get tangled up too much in the boats, because that's a kind of irregular immigration. We're talking here about people who fill out the forms, who arrive. They may well have somewhere they can live, I'm guessing. But it's about whether, in the end, Owen, we don't have the houses for our own population.
Again, for example, one of the biggest increases in net migration was to do with people coming from Ukraine and Hong Kong as refugees. My brother took in a Ukrainian family. That didn't take up any extra housing. He used his spare rooms in order to provide for that family, and that's what lots of Britons did in that situation. That was a big part of the increase in net migration. I would say, look, we used to build a lot more housing in this country. The reason we stopped doing that was because, if you look at the graph, private developers kept building the same amount as they ever have. Public money on housing collapsed. And actually, look, people don't like being told this, but Britain is 2% built on. It's not actually built on in the way people
I disagree with you.
think it is.
I think Owen's right that actually that the solution here is to build more houses. And actually, if we stopped immigration tomorrow, we still would not have enough houses. It's Economics 101. We need to increase the supply in order to bring down prices. However, I disagree that the problem is the public sector, or the problem is we need to build more social housing. The solution is effectively relaxing planning regulation, which thankfully the Labour government seems to be wanting to do. Rachel Reeves announced last week that actually the planning reform is going to happen.
Well, they also said they're going to give power to local communities who will block everything.
Well, yeah, so NIMBYs are the problem.
NIMBYs have got licences now.
But NIMBYs usually vote Conservative. And so there is clear political incentive here for Labour to build more houses and allow young people to get on the property ladder.
Terry, thank you. After the break, more calls on this. Do we need a maximum limit on the number of people? Or do we need to say, as Reem says, look, we need to change our country before we have this many more people in? Now, more calls on whether we need a limit on immigration. The population of England and Wales saw the biggest annual jump in 75 years. It's mostly due to people arriving from outside the UK. This is not about the boats. This is about people, organising to come, filling out a form, coming in a legitimate way. 0207 862 2222. Denise in London, do you think we're on the right track here?
I think we're actually been on the wrong track for a long time, because what's happening is immigration we have to have. That's something that everybody knows that. But what's happening is everybody wants to come here. Why is it that we think nobody ever mentions the problem with the NHS is because we cannot help everybody? I'm up for looking after those that come here as we look after our own. But what I don't understand is that I'm 74 years old, went to the hospital, the queue was so long, and I live in East London, which is the most diverse area. I was born here when it was the Jewish community, then the Chinese community, then the Jamaican community. I haven't got a problem. Those people came then and there was a regulation. Now anybody can come in. And what's happening is we can't look after everybody. It's an impossibility. We cannot cope.
I hear you. It may be having an NHS free at the point of supply is completely incompatible, Owen, with this level of immigration. It just doesn't work.
It's just not true. Without doctors and nurses from around the world, the NHS would literally collapse overnight. People who arrive from other countries are, as I keep saying, younger people, overwhelmingly, who are the least likely to use the National Health Service. Those who depend on the NHS the most are people who are pensioners. The truth is, we have an ageing population. Now, the reason this is important, if we don't have more younger people in work paying taxes, then the NHS will have less money. The people who arrive here are putting in net more money into the exchequers than not.
Okay.
And so the fact is, the NHS depends on money by migrants.
I agree with that, but Owen, I think there's a fundamental difference here, because ultimately, if we want to encourage hard-working people to come to this country, we've got to reduce the tax burden. And the fact that we've got corporation tax gone up to 25% under the Conservative government.
Not high enough.
And no, it's incredibly high.
Why did Rishi Sunak increase corporation tax? Why did he do that?
We are actively discouraging businesses from coming to this country.
Look, he increased it because he said cutting it had not brought in any extra revenue, but the opposite. That's why he did it. Look, the point is, we're talking about corporation.
Let's go to a caller. Go on.
More broadly speaking,
Yeah,
the
but
fact of the
we're
matter
going too
is,
broad here. We're talking about immigration here.
Immigration specifically, the fact of the matter is we cannot cope with our effectively socialist public services like the NHS, and then at the same time importing huge amounts of people.
All
We
right.
can't cope.
Thank you, Denise. In the end, we get rationing of NHS, and that's, of course, what we see when Denise goes to a hospital. She can't get to the front.
not because of our immigrants. We're not funding the NHS.
No,
properly.
we are funding the NHS because the NHS itself is an incredible.
It's not because of migrants
Richard
arriving.
is in North Yorkshire. You can get a word in, Richard, if you move fast.
Yeah, okay. Well, there's 2 points. One, if you're talking about supporting old people and bringing more people in, all the people you bring in end up getting old, and you're on a giant Ponzi scheme by bringing more people in.
Okay. Yes, I
and
hear
the other
you.
Point,
I didn't want to say that
the
to
other
Owen.
point,
Yep.
Yeah, the other point is that in the past 25 years, we've had 11 million people coming to the country. Now, that is larger than Liverpool, Birmingham and 4 northern cities. So if you count the number of hospitals, nurses and everything else you need, all you're doing is bringing people in to look after the people you bring in.
It seems like most people are agreeing that the fact of the matter is the problem is not immigration itself. We want to encourage people to come here. I'm North African. My grandparents came to this country in the 60s, wanted to work hard and contribute to this really fantastic country. But the point of the matter is public services and the resources that we have are finite as a result of the government taking ownership of them.
There's barely any migrants in North Yorkshire. No offence, Richard, but it's got very low levels.
What about that, Richard? No migrants
Why
in
is
North
it? It's
Yorkshire?
always disproportionately people who live in areas of very low migration.
Richard, because North Yorkshire.
I'm not playing anyone against anyone. All I'm doing is giving you numbers.
No, I'm
Have a look at what.
Yeah, well, the numbers
You know
are
what
that
11 million people looks like.
The numbers are we have a shrinking working population unless more people arrive here, and they are supporting an ageing population who depend on healthcare. So you need a bigger working population.
You do not need people working in factories these days. You need automatic factories.
What you just want to get everyone sacked?
Next, another call, please. Mark in Hertfordshire. Hi.
Hello.
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 Hello. Can you hear me?
Yeah, got you.
Yeah. My problem is we're the most overcrowded country in Europe now for our size. Our population's grown by 5 million in the last 5 years.
Yep.
And we can't sustain this increase. 68% of our land is for farmland. And then you've got national parks. You've got areas of outstanding natural beauty. We're running out of land.
What about building on golf courses? They were saying that with golf courses take up so much room, just build on them.
Well, yes, but your panelist said only 2% of the land has been built on. That's not correct. It's over 12%. Our motorways, I've got 10 times more traffic than they were designed for. We've got 9 people who are could be working and fill these gaps. And to take all these healthcare workers from abroad is you're draining their resources and their need is in their country.
By the way, we care about other countries.
I'm going to just pause this here. Thank you very much, Mark. Thank you for all your calls on this. Later, we'll ask whether clowns are funny or frightening.